I get sick, I won't need government cash to help to pay for your huge hospital bill. Hey friend, if you're applying for a green card or you're already a green card holder, listen up. One of the most confusing questions I get is, do I really need health insurance for my green card? Short answer is, it's not officially required by law right now. It can absolutely make or break your case under the public charge rules. Now today, I'll break this down. We're just chatting over coffee, we're friends. So you know exactly what to do going into 2026. Now, welcome back to Immigration Help 101. My name is Annika. My goal is to make this complicated US immigration stuff actually understandable. Now, quick disclaimer before we dive in, this video is for educational purposes only. It's not legal advice. Immigration rule changes and your case, it's unique. Always double check on uscis.gov and the state.gov department. All right? Now, let's get into it. So why does health insurance even matter for a green card? The magic phrase here is public charge. US immigration law says persons can be denied a visa or a green card if an officer thinks they're likely to become a primary dependent on the government for support in the future. So that's what officers are checking when you apply for an immigrant visa or a US consulate abroad or adjustment of status with USCIS in the United States. Under the current DHS and the USCIS rules, officers look at the whole picture: your age, health, family size, income, assets, education, skills, and whether you've used certain cash benefits in the past. So health insurance is not by itself a yes or no requirement, but it's a big part of that financial health picture. Here's the part that confuses everyone, if not all. Right now, under the 2022 DHS public charge rule, there is no separate law that says you must have the health insurance to get a green card. What does happen is, for the consulate cases, the State Department says you must show you won't become a public charge. Officers look at your financial support, usually through the I-864 affidavit of support, plus things like age, health, and job prospects, right? You guys can check the travel.state.gov for that piece of information. Now, for USCIS, which is the adjustment of status cases, officers use the USCIS policy manual to weigh your income, assets, and health situation. They don't have a checkbox that says no insurance equal automatic denial. So in 2025, going into 2026, health insurance is technically optional, but it's practically important at this time. Now, why are you seeing like and lawyers talking about, the health insurance for green card application in 2026 so much? If you're not watching the news or our social media, you won't see it. But because under the public charge test, officers has always been allowed to consider how you'll pay for medical care, right? Newer DHS rule basically goes back to the long-standing, more humane approach, but it still lets officers look at your current health and financial resources when deciding if you might become a public charge. Now, okay, what can you actually do? Let's talk about it practical, right? The practical options that you might have. Now, number one is employer-sponsored insurance. Now, if your U.S. citizen employer offers coverage and as the immigrant is eligible to be added as the beneficiary, now that's usually a strong evidence, right? Proof of it, like benefit letters or enrollment confirmation. Number two is the marketplace or the Affordable Act plan. Many people who are lawfully present, they can buy plans through the healthcare.gov or the state market, right? The state marketplace. These are private plans, even if you get a premium tax credit under current rules, using that kind of should not affect you as per USCIS. Now, number three is the short-term or private plans. Now, some people use short-term or private visitors types policies or in transition, right? Might not be comprehensive, but they can still show an officer that you thought about the medical costs. Number four is the strong affidavit of support plus savings. Now, if you really cannot get insurance before your interview, then it's extra important for that the sponsor that you use, they meet the income, right, poverty guideline, that you can show some savings or assets if it's applicable to your situation. Department of State and USCIS both emphasizes financial support from sponsors in their public charge analysts. Now, whatever you choose, right, prove to your interview if you have it. Things like insurance card, policy documents, letters from your US citizen job, or screenshots of printouts from the marketplace enrollment if it's applicable, right? Fit this way. With health insurance, you're showing if I get sick, I won't need government cash to help to pay for your huge hospital bill. Now, without insurance and with a low income, an officer might worry you'll struggle with medical costs and that can hurt you in a public charge analysis. This presumed assumption, is for the coming year, in my opinion. So, headed into 2026, here's my friendly guidance to you all, right? If you can get health insurance, do it. But keep in mind, not everybody can access health insurance based on what their situations are, right? No, keep every document that shows your coverage or your plan to enroll. Make sure your Forms I-864 sponsor is strong, meaning the income, the tax return, job letter, the whole package. Okay. Always double check the latest public charge guidance on uscis.gov or the state.gov website because policies can shift with the new administration or the new rules. Okay. If this helped you to clear up some confusion, I want you guys to, go ahead and like and subscribe to our channel at Immigration Help 101 right here on YouTube. Now, until next time, good luck with your immigration journey, and I'll see you guys in the next video. Bye.